Hey guys, Tammy Anderson Ward here. We're going to go ahead and do an overview on the next super patch called Freedom.
Freedom is really wonderful because it can get people out of pain. I've seen people actually notice within minutes their chronic pain actually gets better. And they're so incredible. I can't believe it. I'm like, I can't believe it. And I see this over and over again. And if someone has a joint pain, you put it above or below. Sometimes I nest it or like back pain. So many people have back pain. I put it on the lower part of each side of the back because you want to put the freedom patch near the pain, but not on a joint. And sometimes you might need more than one. I think it's more effective sometimes when you actually,
That's really
come on
severe.
each side, and because people you want them to actually feel better, and you don't want to like penny wise pound foolish, cut it short. So and yeah, it's the only patch that really needs to be near the pain.
Right.
You can wear more than one.
Mhm.
Um, and I know you have a really amazing story
Mhm.
with your husband.
Yeah, so my husband has uh he's a UPS driver. He's been doing hard manual labor literally for over 2 decades. I think it's like 23 years or something like that. And it's not just like 8 hour job. It is a lot longer than that. Plus, he's got a commute about 45 minutes each way. And when we came across the super patches, we met you guys at a conference. And it was a large conference where we had 2,700 attendees. We actually opted to get carpet for people because we know they're walking on the cement all day, but we also were thinking about ourselves and our vendors and our speakers as well. We wanted them to have extra support and comfort as well. But even with walking on the carpet, throughout the days. At the end, we were kind of hobbling around a little bit, and so we met you guys. You were towards the back of the vendor space, and we got all patched up, and it was like instant relief for my husband and myself, but especially my husband. He has had this pain in his sacrum between his low back and the hip area down between the buttocks. And so he'll actually take two of the freedom patches and put them right on his butt cheeks. Actually, it's kind of funny, but he's got the marks, you know what I mean? Because he wears them every day. And the cool thing is, he can tell from one day to the next if he's forgotten to put them on, and he does not forget because it's as important to him as, or even more important than brushing his teeth. Like it's got to be one of those daily things because it gives him such relief. And knowing my husband so well and knowing what he has experienced in the past versus now, it is a tremendous experience for me to be able to see the relief that he gets just from simply putting on these patches. I know it works because of watching him in real time get that level of relief. And I know it doesn't work for every single person. We're talking about 96% of the people that we've personally used it with get a lot of relief, but there are every once in a while someone who maybe doesn't. And for whatever reason, right? I don't know because I'm actually not a doctor. I just know what I have seen and what I've personally experienced and also witnessed. And it's really cool to be able to observe that and to be able to offer people this alternative to, meds or whatever else that people are using for their pain relief. So, yeah, why does it work? Do you know?
Well, it stimulates it's like a specific code for pain. You know how he figured this out? He put 250,000 people's brain waves into a database and cross-referenced the symptoms with
Oh,
the wave, isolated it, and then tested it, the isolated wave. And there's an inverse wave, so you have wave cancellation. So if you have a wave for pain that shows pain, then if you actually put the inverse of it, you're actually recalibrating it to factory settings essentially. When it's kind of like restarting a computer that goes wonkers. But people with amputation, and I've seen them at your event. They came in a wheelchair and they were amputee, and we put a freedom patch on either side of the stump, and the pain went away. Why? Because it's almost like they had their injury a long time ago, and but the brain kind of thinks it's more current. It's almost like it hasn't given up, that it's still like it hasn't recalibrated. So all of a sudden you're canceling out that, and then they're being grounded to reality. Because the reality is the stump was healed a long time ago. They shouldn't have pain
Yeah.
in a way that they don't have. So that's kind
Yeah.
of like really, really amazing. That's kind of like it's a wave cancellation. It's additive properties of waves, and that's how they work. But in terms of why some people,
Hmm.
sometimes it takes, 84% of the people feel it within 2 weeks.
Yeah.
Some people feel it immediately.
Yeah.
Some
Casey
people,
was immediate for sure.
so
Yeah.
it's, I mean, if you have let's say if you don't have a misfunctioning thing, it's not going to work if you don't need it. So
Right.
sometimes if like the patches won't help someone if they don't have pain, for instance. So, but I do think it's user error. Like I've had people put it on a joint,
Yeah.
unfortunately,
Like your elbow.
that's why I like to, and again, I worked for 2 hours and they wore it out because someone put it on a joint.
Right. Right.
So I do think user error is huge. Also, they might need more than one. Like,
Yeah.
and then just put one on and they need two that might, want to brace it. So that's probably another reason it maybe one didn't work.
Yeah.
I think given enough time, sometimes consistent use over, it might take a month for
Yeah.
them to feel the difference. So I think it's very individual.
One other thing that I was just thinking about was last summer we were having a camping trip, and I of course forgot to drink as much water as I needed, and I was sleeping on this not comfortable mattress in the camper, and all these things kind of contributed to me getting a really bad migraine. And Casey pulled out the patches and said, "Well, I've got a few extra freedom patches." So we actually put one right on my forehead and then one at the base of my neck right here. And it took about 10 minutes and I started getting some relief from it. But then I got worried I was going to have like a sunburn around, right in the middle of my forehead. So I put a hat on. Anyway, it was cool because it did take me probably about 15, 20 minutes tops for the relief to really get to where it was going to be. And it was such a game changer. And then, of course, I drank water and electrolytes and Casey gave me a little massage, to release my tension I had in my muscles. But it was like nice to be able to have something else I could partner with it. You know what I mean? Because I don't know if you've ever had migraines before, but they can be very debilitating. So to have something that could really give it some relief for me,
Right.
I don't get migraines anymore like I used to, but that one that it was coming on so fast and I had an option besides just regular, you know what I mean, what somebody would normally do. So it's kind of nice to be able to have this. I know my husband has got such a stock now. He's been like, he's like, I cannot be without these. Like this is such a game changer for him. I will be forever grateful. So anyway, thank you so much for helping us to understand a little bit more about the Freedom Patch. Of course, we're not making any claims because that would be something that we can't do anyway. But what we're saying is give it a try because if you've got chronic pain and you've already tried all these other things, the fact that you can put this patch on, it's not something that, is going to, like basically mix with other medications or it's not a medication. So it's like you don't have to worry about it messing with your brain in all of these other ways. So it's kind of nice to be able to have that as an option. So
Drug-free, supplement-free, and it doesn't conflict with anything else. So if you're on pain medication, it's not going to be a conflicting thing. You might be able to wean off. I'm not going to make promises, but I mean, just give it a try.
awesome. All right. Well, thank you guys so much. We'll see you in the next video.